Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Tegretol or Carbamazepine. It was originally approved in the United States in 1968, and then an extended release form was available as of 2014. It's a treatment for epilepsy, multiple different types, and neuropathic pain. In 2004, it was also given approval for treatment of mania associated with bipolar disorder. It's also been used with limited success in depression, schizophrenia, attention deficit hyperactivity disorder, different pain syndromes, psychosis, restless leg syndrome, and drug withdrawals. It was originally described in 1953 by a Swiss chemist working for Geigy, that's now part of Novartis. Was first used in Switzerland in 1963 for epilepsy and trigeminal neuralgia. Then it was referred to as tic douloureux. In 1971, because lithium was not available in Japan, it was used as an add-on treatment for people who had mania, and it was found to be relatively good. It's listed in the World Health Organization, the WHO, list of essential medications. But you have to remember, this is not a simple analgesic. You don't take it for trivial aches and pains. But on the other hand, it's so commonly used that it's been detected in wastewater effluent, and it accumulates in foods grown in soil that's treated with sludge. Now, it's of no apparent harm to people in those low doses, but that's how widely used and abused this drug is. Now, it's important to realize that one seizure doesn't mean epilepsy. Seizures can be caused by any number of factors. Factors that might have to do with meningitis or stroke or low blood sugar or alcohol withdrawal or liver or kidney disease or use of illegal drugs or brain tumor or vascular disturbances. However, seizures are present in somewhere between 5 and 10% of people by age 80. The presence of more than one seizure that occurs in about 50% of the time, that's when we diagnose epilepsy. Epilepsy occurs in about 2.5 million people here in the United States, with 13% of them, or about 300,000, less than age 18. Epilepsy can be divided into partial epilepsy that affects a localized area of the brain, or generalized epilepsy, and it would appear that Tegretol can be used for almost all kinds of epilepsy. Now, people aren't aware too much of the focal epilepsy. The focal epilepsy is a condition that affects part of the brain. A person may or may not lose consciousness, lasts for about 1 to 2 minutes. It's associated with some warning signals, maybe a blank stare, loss of contact with the surroundings, a change in mood, maybe some automatic behavior, picking at the clothes or chewing, or the muscles relaxing and contracting, or some numbness and tingling. Maybe some abdominal pain or some flushed, sweaty skin, dilated pupils, and afterward the person can't remember too much about what happened, may be sleepy and confused. These simple or partial epileptic attacks occur in about 50% of the people with epilepsy, and the generalized tonic-clonic epilepsy and associated conditions occur in the other half. Now, the dose typically for epilepsy starts out relatively small and gradually increases up to about 1,000 milligrams a day in people between the ages of 12 and 15. And people over age 15, the dose might be increased to about 1,200 milligrams a day. It's also used for the mania of bipolar disorder. Now, bipolar disorder affects somewhere between 2.5% and 5% of the population, and 1% have the bipolar disorder. It's important because 1 in 4 people attempt suicide, and 1 in 10 people are successful in their attempts at suicide. Now, bipolar means it has 2 poles. One is depression, the other is mania, and most people alternate in between the two. And about 10 or 20% of the people cycle rapidly. That means they have at least 4 attacks of mania or depression during the course of a year. The symptoms are confusing because they can be the same thing as with hyperthyroidism or use of amphetamines or certain steroids. Untreated, the symptoms last for about 3 months. Then a person can be normal for weeks to years and then develop depression. And on treatment, about 50% of the people don't have any symptoms over a 10-year period. The mania part is associated with racing thoughts, the need to continue talking, feeling the need to stay awake. People aren't sleepy, they're irritable, maybe they have a high feeling, they're distracted, they're involved in activities that could have risky consequences, maybe inappropriate spending, inappropriate sexual activities, or inappropriate joking or laughing. These people who have bipolar disorder typically can be treated with either lithium or Depakote. If they're treated with Tegretol, there are no specific blood levels that we check. A breakdown product of Tegretol is Trileptal, another medication that happens to be used to treat this disorder. We know that the mania part of bipolar disorder has a lot of different treatments, and Tegretol might not be the best. Maybe lithium is the best. Lithium is a good drug, but it has substantial side effects when it's used at moderate to high doses. Trileptal is another choice. Lamictal is another choice. Depakote or valproate, gabapentin. Some people use the atypical antipsychotics like Abilify or Seroquel or Zyprexa. Most of the patients who have the mania part are taking an anti-anxiety medicine, and 2/3 are taking an antipsychotic. Lithium is an extraordinarily good drug, and it's probably the only drug that treats the aggressiveness and impulsivity of mania, but it has a very narrow therapeutic index and is not for pregnant women. Tic douloureux, or trigeminal neuralgia, tends to occur in people who are over age 50, about 150,000 new cases every year, with women being the largest group of patients. It's associated with excruciating pain, stabbing, shocking, electric-like pain that tends to occur in the central and lower face and jaw. Sometimes it affects the nose or maybe even above the eye. The trigeminal nerve supplies the face. It has 3 branches. One goes to the forehead, one goes to the cheek, and one goes to the chin and jaw. And it's the chin and jaw and the cheek that seem to be most affected. The trigeminal neuralgia has pain that lasts for seconds to a couple minutes, and it would appear that there are 2 different kinds of trigeminal neuralgia. The classic type occurs 75–85% of people. These are the individuals for whom Tegretol seems to be a good treatment. There's no established cause, but it may well have something to do with a blood vessel lying on top of the nerve and compressing the nerve. Then there's the symptomatic form that's associated with maybe about 15% of the people. They have other structural abnormalities of the brain, maybe multiple sclerosis, maybe they have an abnormality of the skull base, maybe they have a tumor. It tends to be in somewhat younger individuals. Well, trigeminal neuralgia occurs in cycles, long stretches where people have frequent attacks, and then they can go for weeks, months, or years without any pain. Usually the pain intensifies over time with shorter pain-free episodes. Now, people can have anywhere between less than an attack a day to several dozen attacks an hour. Some of these people have uncontrollable facial twitching. There are triggers that seem to set off trigeminal neuralgia. Sometimes it's exposure to wind or dust or drafts or certain kind of foods, maybe in some people coffee or bananas or hot spicy foods. In other people it's touching the skin or blowing the nose or brushing the face or even smiling. Now, the Tegretol is almost a diagnostic test for trigeminal neuralgia. A low dose given one time, 100 milligrams, seems to bring rapid relief. And as a matter of fact, if it does not bring rapid relief, it probably is not trigeminal neuralgia. Over a period of time, the dose has to be increased somewhere between 300 milligrams and 1,000 milligrams a day. Now, in about 75% of the patients, it seems that the medicine is going to be appropriate, and it can go into remission for anywhere between 6 and 12 months. Then it tends to recur, and ultimately, it seems that the Tegretol by itself might not be sufficient. The person might have to take 2 or 3 different kinds of medicines, and it's often associated, the tic douloureux or the trigeminal neuralgia, with depression. And if the medication fails, then it might be appropriate to use a surgical approach. Other treatments for trigeminal neuralgia, well, they would include valproate or topiramate or baclofen, gabapentin. There's not really great data for some of the medicines like Trileptal or Dilantin. The side effects of the medicine can be quite hazardous. So some of the side effects are relatively mild, sometimes associated with dizziness or drowsiness or unsteadiness of the gait. We call that ataxia, motor incoordination. Sometimes with nausea, vomiting, constipation, headache, blurred vision, double vision, leg cramps, or maybe fatigue. But even worse, we start getting hair loss and edema, fluid retention, worsening of high blood pressure, urinary frequency, or urinary retention, potentially renal failure, erectile dysfunction, and pancreatitis. Now, this drug may interfere with production of a hormone and cause a low sodium and water retention. But more importantly, it can cause suicidal thoughts. Almost any epileptic drug can cause this. So when people are taking a drug like Tegretol, they have to be watched for emergence of depression or suicidal thoughts or unusual changes in mood or behavior. Occurs about twice as often as it does in a placebo. Have to be careful of a variety of other drugs. If you're taking Tegretol, you shouldn't take Surzone. That's a rarely used antidepressant. Shouldn't take an MAO inhibitor, that's an antidepressant, within 2 weeks of the drug. Shouldn't take the drug if you have a history of bone marrow suppression or hypersensitivity reactions, major allergic reactions, or if you're sensitive to the tricyclic antidepressants, imipramine or dizipramine or imipramine. You don't take it if you have a certain liver disorder called hepatic porphyria. And you don't abruptly discontinue the drug. If you've been taking it for a while and abruptly discontinue Tegretol, you might have multiple seizures and even a condition known as status epilepticus that can be associated with low levels of oxygen in the system, and that can be life-threatening. If you have a cardiac conduction abnormality, second or third degree heart block, well, this drug isn't for you. If you have liver function abnormalities, maybe because you're a drinker, maybe because there's some other disease that you've had, maybe hepatitis. Well, if you take this drug, the liver disease may progress to liver failure, and it can damage the kidney. And even more importantly, it can damage the bone marrow's ability to make the granulocytes. The granulocytes are the white blood cells that fight infection. And as a matter of fact, it also can inhibit the bone marrow's ability to produce the red blood cells, and you can get an aplastic anemia. Well, it also causes a lower level of platelets, another blood element. That's an element that causes clotting. And most people who take the drug are going to have a slight decrease in the platelet count. So it requires a lot of blood monitoring if you're going to take this particular drug. And you may have a skin reaction. Now, the skin reactions associated with Tegretol can be horrible. They can be what we call toxic epidermal necrolysis, where the skin dies and just falls off in big sheets, or Stevens-Johnson syndrome, where you get blisters that can involve the mouth and the skin in general. Major kind of problems. Now, sometimes people can develop simple rashes associated with Tegretol, maybe the rash that would look like measles. That tends not to progress on. But if a person does develop a rash, well, good idea to talk to the doctor. And there's a genetic predisposition to develop all of these kind of problems. And it seems that in more than 90% of the cases, the reactions are going to occur during the first few months of therapy. So people need to be screened, and especially if you happen to be of Asian descent. It seems that there is a particular type of genetic locus. We call it the HLA-B1502, and it can be tested. And it seems that it's present in about 15% of Japanese and the Tamils from South India, and 10% of the Han Chinese and the Koreans. It's present in Thais and in people from Hong Kong and Taiwan, and sometimes it's present in other individuals. Now, There's another variant that can be tested for, and it's the HLA-A3101. Why these are important is that they're associated with those terrible rashes, and the terrible rashes that may lead to death. Now, sometimes people can be positive for even both of these particular type of abnormalities and not have any kind of a reaction. And then, unfortunately, some people can have a negative test and still develop the reaction. But it's important to consider testing people, especially if they're of Asian descent, and especially if there are potential real-life consequences, like a person has had a kidney transplant. Well, if you've had hypersensitivity reaction to any other anti-epileptic drug, you got to be extraordinarily careful taking the medicine like Tegretol. And if you've had a hypersensitivity reaction to Tegretol, chances are you better stay away from Trigeminal. Well, it also has mild anticholinergic activity, which means if you have a tendency to high pressure inside the eye, this drug might not be for you. Or if you have a tendency to asthma, or if you have a tendency to certain other kind of problems, maybe urinary retention, maybe you have an enlarged prostate, again, the drug isn't for you. And in animal testing, it seems to have the potential to cause cancer. Cancer of the liver in female rats, and it also caused testicular tumors that appear to be benign in male rats. And it also interacts with a variety of other medicines. Now, this drug is metabolized by an enzyme in the liver known as CYP3A4. And drugs that inhibit that enzyme are going to push up the blood levels of Tegretol and potentially cause problems. So you probably don't want to take Tegretol if you're taking erythromycin or an antifungal medicine like fluconazole or ketoconazole, or an anti-epileptic drug like valproate, anti-mania drug, or even ibuprofen or grapefruit juice. On the other hand, if you take an inducer of that enzyme, the CYP3A4, it could decrease the concentration of Tegretol. So if you're taking rifampin or phenobarbital or theophylline, going to interfere with it. And other drugs that you need to be careful of, because the Tegretol can interfere with the metabolism of warfarin or cyclosporin or thyroxine for your thyroid, or birth control pills or Dilantin or certain antipsychotics, and even the pain medicine known as tramadol. And you have to be cautious if you're taking isoniazid for tuberculosis, or if you're taking a water pill like either Lasix or hydrochlorothiazide. If you're pregnant, this is definitely not the drug for you. It can cause possible fetal harm. It causes malformation of the heart, the spine. It can cause delayed development, especially a problem if you combine it with other anticonvulsives. And it concentrates in the fetal liver and the kidney and can cause problems. Now, before you take this drug, you need to have a battery of blood tests. You have to have your white count, your red count measured, the platelet count measured, iron in the reticulocytes, the liver function tests, the kidney function tests, the sodium, the thyroid, and often it's a good idea to have your eyes examined, at least as far as finding out what the pressure is, and some of those other tests that I mentioned, like the HLA-B1502, if it's appropriate. When you take the medicine, you do it with meals. You start with a low dose and you gradually increase it as necessary. There's a coating on the extended release form. The coating is not going to be digested. It's going to be found in the stools. That's perfectly normal. Now, if there's a damage to the coating, you do not want to take the drug. The drug is bioavailable probably in a quite significant fashion, so we don't have to worry about it getting in. It's metabolized in the body, and then it's excreted. About 3/4 of it go out in the urine as a metabolic byproduct, and about 1/4 of it goes out in the feces. Now, interestingly, Tegretol can induce its own metabolism. So when you start taking it, the half-life of the drug is up to 65 hours. But after you've been taking it, it induces its metabolism, and then it has a half-life of only about 12 to 17 hours. If you overdose on this drug, you're going to have significant problems, neuromuscular problems. You can have disturbances in the respiratory system, irregular breathing, irregular heart rate. It might lead to an increase or a decrease in the blood pressure, leading to shock, a change in consciousness, tremors, convulsions, deep coma, affect the kidneys. There's no specific antidote if you overdose on this medication. The way it works is it interferes with some of the sodium channels, so it makes the nerves not fire as much. And it also seems to have some effect on the serotonin system, so it releases the serotonin into the system, and it probably blocks the reuptake of the serotonin, sort of like Prozac and Zoloft. There's question about whether it works on GABA as far as taking care of the neuropathic pain. Now, the price for the drug tends to be relatively mild. So you get the immediate release form. The cash price is somewhere between $40 and $95 a month. If you have a coupon, it's about half that much. If you take the brand name, it's 2 or 3 times that much. So when we talk about Tegretol, we have a potentially very useful drug, but unfortunately it's handed out like candy for a lot of diseases and disorders for which it probably has no medical indication. Doesn't work nearly as well as most people believe, and sometimes people who take the drug are met with devastating side effects. So if you're going to take Tegretol, it's a good idea to proceed with caution. Thanks for watching. I'm Dr. Ken Landau.